Welcome back. It has been a week since a man had a mental health crisis in Northwest D.C. DeAndre Bigsby fired a gun, exposed himself, climbed on power lines, and created the standoff with police that ended after nearly 8 hours. But tonight in a Fox 5 exclusive, David Kaplan went one-on-one with Bigsby's parents.
And they say that they've tried to get him help, but keep running into very frustrating roadblocks. David joining us live outside D.C. Superior Court with more on their conversation. Hey, David.
Jim, Marina, good evening to you. You just walked through some of those allegations against Bigsby. A preliminary hearing just wrapped up this afternoon. A judge ordered all of those charges to be held against him and that he stay in the D.C. jail. Tonight, only on Fox 5, we spoke with Bigsby's parents and a family friend and mental health advocate who talk about their efforts in the last couple of years to try and get him help and where they've had a hard time getting answers.
Oh, God. I pray to God that he gets some help. And that's where I'm at.
Annette Bigsby wants you to see this version of her 39-year-old son, DeAndre, a man who's funny, smart, loves to cook, dance, be with kids, she says, and a man living with mental health diagnoses.
His father and I has been dealing with this for years.
Last Wednesday, Annette and DeAndre's father, John Coleman Bay, watched in horror as their son had a very public episode. Police allege Bigsby threatened a group of women and fired a gun towards an officer in the moments before the hours-long standoff.
Watching the incident unfold with my son on Wednesday is heartbreaking. I could have watched my son fry.
DeAndre's family says he's been treated in the past for schizophrenia and thinks there are enough resources available to him in Washington. Their frustration, those resources not necessarily communicating with them, a strong support system to try and help prevent what happened last week.
When the diagnosis was made, her and I should have been involved at that point. So we'll know exactly what we're dealing with before a crisis comes.
It would be a helpful thing if folks at the jail or folks at the emergency room knew about this person's history and was able to talk with this person's provider.
Louis Bossing's an attorney with the Bazelon Center for Mental Health Law based in D.C. He does not represent DeAndre Bigsby, and he says patient privacy laws are important but can limit sharing mental health information without the patient's consent, with exceptions. He says more, though, can be done on a community level to abide by those laws, but help patients and families understand the benefits of sharing medical information.
We are interested in communities creating systems where people who are receiving services can be engaged in understanding why it might be appropriate or why it might be helpful to them or useful to them to have information shared.
For now, DeAndre Bigsby's family will continue fighting for him, they say, advocating on how to be more involved and, importantly, focus on tomorrow and beyond to help him going forward.
I'm a concerned mother. I'm not going to allow my son to just be alone. I'm going to support my son. Regardless of his behavior, he's my son. I'm never going to be ashamed of him. I love my son.
Annette Bigsby also told me she's starting the process of exploring if she can somehow maybe get power of attorney over him to help with some of the decisions regarding his mental health, to give her and the family and the support system more control. We did reach out to the Department of Behavioral Health here in the district, who said that, yes, sometimes the HIPAA, the Patient Privacy Act, does prevent them from sharing information about family members, but they also did want to note that there is help out there, the new 988 crisis hotline. If anybody has a concern about a loved one, they can always call that number. That's what the district's encouraging people to do. Back to you.
A follow-up worth hearing for everyone tonight.